Hello, and thanks for listening to Health Professional Radio. I'm Henry Acosta, the host for this segment. Today on the show, our guest is Phil Calvert of the APA, or the Australian Physiotherapy Association. Phil is part of their board of directors and is also their national president. He is a very well-achieved health professional and is the leader in a lot of industries. He has a master's in physiotherapy, a degree in health service management, and is a graduate of the Australian Institute of Company Directors. Today we're here to talk about the APA and the aged care funding instrument and what they have or what their position is about the topic. With that, welcome to the show, Phil. Pleasure to have you on board.
Thank you, Andrew. Thank you for having me on.
And just to get things started, we just wanted to know, can you tell us how you got started into physiotherapy and what led you into getting into this type of work?
Oh, sure. Look, I was always interested in physiotherapy because of its role in sport, particularly elite sport. But when I actually was accepted to study physiotherapy, I became exposed to a range of other areas, and the area of paediatrics was one that really, really appealed to me, working with kids and families and seeing the types of difference you could make to someone's life or a family's life really appealed to me. And so I've been a clinician actively working in paediatrics since I graduated.
Can you tell us a little bit more about the APA? What do you guys do and what do you guys provide?
Yeah, sure. So the APA is the peak body representing the interests of Australian physios and their patients. We're a national organisation and we've got non-autonomous state and territory branches and a range of clinical and non-clinical specialty subgroups. We have just over 24,000 members nationally at the moment, and a great proportion of those are active volunteers in a range of areas on committees or working parties and the like. We do a number of things. Firstly, we place a strong emphasis on the provision of high quality and contemporary professional development for our members so that they're abreast of current research, good evidence-based practice, which we know helps improve their practice. We assist our members with a range of professional issues to ensure they're able to do their jobs to the highest possible level, and whether that's advice around new funding models or changes to regulatory requirements. As examples, we place a really strong emphasis on those aspects, and we advocate across a range of issues and a range of levels on behalf of our members and their patients, with the primary goal of improving access to high-quality physiotherapy services for all Australians. So in a nutshell, they're the primary aims of the association.
With regards to that, we're supposed to talk about the aged care funding instrument. Can you tell us what it is and what's going on around it?
Yeah, sure. So the aged care funding instrument is a funding tool that, in our view, doesn't reflect contemporary evidence-based practice to support people living in residential aged care. And when we think about people who are living in an aged care setting, our view is that people should be thought of as if they're living in their own home. We don't think that they should be considered as living in a hospital, but there should be a really strong emphasis on helping people to live normal lives as they would in their own home. So helping them to be able to do things like dress themselves, feed themselves, and have the mobility they need to be independent. And those principles to us are really, really important. But the problem with the aged care funding instrument as it currently sits is that it's far more based around a model that supports people once their health deteriorates or once they have health problems. We think it's more important that the funding instrument supports people to stay well and healthy in the setting in which they're living, and certainly kicking in when people's health declines. But the changes that we're really, really keen on seeing is helping people to live as normal a life as possible in the setting in which they live. And in aged care, again, it's about making sure people can do things that they want to do that enhance their quality of life.
So what are the common misconceptions around the aged care funding instrument?
Look, misconceptions, I think a better way to frame that discussion is around what's the type of care, both, good quality care, but also care that increases value for both the patient and the system, and what type of care is needed to meet those goals. at the moment, the funding instrument doesn't really reflect good contemporary practice in terms of managing people's healthcare. So I think if you start from a level of thinking about what increases value to the person and the system, what's reflective of good evidence-based practice, they're the principles we'd like to see considered more strongly in terms of the funding instrument itself.
And why do you think there's a lot of issues around the instrument?
Look, potentially because it's been traditionally focused. I mean, we have advocated for some time that the funding mechanism for people living in residential aged care hasn't been sufficient and hasn't been contemporary in its approach. And I think the important thing is that, collectively we're looking forward at how we fix it. And, one of the roles of the APA is to advocate on behalf of its members and its patients. We see that it's really important to do that in a collaborative way. And certainly that's the way that we're approaching this. We're working with other aged care providers. We're working with government to try and work through this issue and improve the funding model for people living in residential aged care.
Are there any other certain issues that maybe you think listeners should be aware of right now?
Yeah, sure. Look, the APA is advocating strongly across a range of areas related to funding streams and funding models. And I think, some examples that I could talk about, certainly the private health insurance system and the Medicare review, both of which we're strongly involved in. In terms of private health insurance, the private health insurance model, again, has a real focus on supporting people when they have an injury or an illness and doesn't really support people in terms of preventative health approaches. And if I can give two examples, one would be a recent clinical care standard on osteoarthritis that was released last week that the APA endorsed. And this really clearly demonstrates on an evidence-based approach that conservative management of osteoarthritis of the knee can be highly effective and prevent the need for surgery. But unfortunately, the concept and the role of prevention isn't supported in the primary health insurance model, and similarly not in the Medicare model. So again, we're strongly advocating that those systems have an increased focus on prevention and, again, providing the best value care for a patient and the system. We know that hospital admissions are really expensive, and to be able to avoid some of those types of things happening through good quality physiotherapy intervention, as an example, makes a lot of sense. It makes a lot of sense for the system, but also for individual patients. So it's a shift in the paradigm around the importance we place on prevention compared to just treating people when they get sick or unwell. Another really good example at the moment is the role of telehealth, and the APA really supports the changes announced in the federal budget 2 weeks ago that increase funded telehealth services for psychology for Australians. We know in physiotherapy there's a range of areas with very, very good evidence to support telehealth approaches. And the real benefit in telehealth approaches is that it increases the opportunity for access by people living in rural and remote Australia and those with disabilities or problems with movement. That means that face-to-face consultations with their healthcare providers may not be terribly easy. But again, currently, both private health insurance systems and the Medicare system don't support telehealth for physiotherapy in those models. So again, it's a really common sense approach that means that we're treating patients, in a really effective way, but also, significantly improving their access. And so we'd strongly call on private health insurance systems and the Medicare system to allow reform in those areas to increase access for people on telehealth approaches. So they're just two examples of things that we think are really important that reflect really, some minor changes to those systems, but would produce, significant benefits for Australians that need physiotherapy care.
Yeah, it makes a lot of sense to help improve the system. When do you think how long do you think it would take for these changes to happen around the industry?
Look, that's a difficult question to answer, but I guess the key message from our perspective is that we'll continue to work collaboratively with a range of stakeholders in the area and with governments to try and modify those funding systems and improve them over time. And we're certainly heartened by the level of interest that there is in reform across a range of areas in healthcare delivery at the moment. So we'll continue to work really strongly and really collaboratively to make sure that those changes are reflected in those systems over time.
What do you want our listeners to conclude or learn from this interview?
I think there's a couple of things, Andrew. Firstly, many people don't have a strong appreciation of the breadth of physiotherapy practice in Australia, and I think when I think of physiotherapy, yes, physiotherapists place a really strong emphasis on operating in an evidence-based model. We have incredibly strong connections to our medical and other allied health colleagues, particularly general practice.
Yeah.
We look really carefully at analysing what we do critically, and the physiotherapy evidence database at the moment has over 30,000 clinical and randomised controlled trials, which I think is a great reflection of the fact that physios look critically at what we do and try and modify what we do in the interests of our patients. We work with patients that are from very, very young ages, so premature babies right through to people living in aged care. We work in areas in private practice. We work in the public healthcare system. We have physios working in education roles, in policy roles, and in research. So I think when you think about physiotherapy, it's sometimes, very natural to think about the elite sporting environment, but physiotherapy is working really hard across a range of areas and a range of age groups to improve, the health outcomes of Australians. And the other thing I think is important in talking about physiotherapy and its value is the role that it can and does play in preventing a range of conditions, chronic diseases, and maintaining the health of Australia. So we certainly have a strong role when people get sick, or when they have an injury, or when they have a stroke, or when they're in hospital and need support breathing, or if they need help developing or improving their movement. But we also have a really, really strong role to play in the prevention of a range of diseases and illness states. And I think that's a really important thing for people to understand about the profession.
For people who are interested in getting in touch with APA and maybe you, how can they do that?
Well, the best way is through our website. So it's www.physiotherapy.asn.au. And there's a range of contact details and a range of information on our website for physios and for consumers of physiotherapy services and funders, as well as my contact details and a range of staff at the APA. So if anyone wants to make contact or has any suggestions or comments, really happy to hear from anyone that's listening.
All right, well, that's all our questions for today, and thanks for coming by. It was a pleasure talking to you.
Thank you, Andrew. Really appreciate your time. Thank you very much.
And that was Phil Calvert, the president of the APA, or the Australian Physiotherapy Association. We just finished talking about the APA and some current industry issues that we should be aware of. If you want to listen to more health-related interviews, you can go on www.hpr.fm. We're also available on SoundCloud and iTunes. I'm Henry Acosta, and thanks for listening. You've been listening to Health Professional Radio.